Right.
Do you suggest any like tips and tricks to, if this is your first time, your first kid, and you're like, every time I go in with a toothbrush, they're like, I don't want it, I don't like the way it tastes, whatever. What are some tips and strategies?
Each child is different, but I would say one thing that I've found to be very effective, and it makes it fun, Sonicare for Kids toothbrush.
Really?
Yeah.
Is that your favorite?
That's my personal favorite.
Wait, do you mean like the ones that with like battery powered?
Yeah. So Sonicare makes some. I think they've got. I don't want to misspeak here, but I think they've got some with Disney characters on
Oh,
it.
that's
Probably.
fun.
That sounds.
Yeah,
But
I know-
isn't it any electric toothbrush for kids?
Yeah, you know, a nice thing about an electric toothbrush is you really just have to get it there.
Yes.
Oh, okay.
You know, you don't have to do the manual
Just let it sit
brushing
there.
motion.
Right.
You just have to get it there and get it to the right spot, and it's doing the brushing for you.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts. Today's episode is something I know we're both interested in.
Big time.
Yes, pediatric dentistry.
You've got 3 boys.
I mean, I am
Lots of
very
teeth.
concerned with their teeth, and they do have a lot of teeth.
a lot of teeth. And you know, I've got the one, and what I'm always thinking about is just if I can get him to brush at least twice a day. Please brush twice a day.
Yes.
And so far, so kind of good.
Good.
So, yeah, I know.
Well,
What
we're
about
going
your-
to talk about all kinds of preventative treatments you can do and what your role is as a parent. It's going to be great.
It is going to be great. And today we're going to be joined by Dr. Ethan Erwin. Dr. Ethan Erwin is a cosmetic and general dentist at Smile Hot Springs in Central Arkansas.
Sounds so great.
We should bring him in. Well, hello there, Dr. Ethan
How's it going,
Erwin
guys?
join us today.
Hi.
Welcome.
Good to have you. We
Oh,
are so
I'm glad to
excited
be here.
talk to you. Yes. Tell us all about pediatric dentistry. Well, tell us your background first.
So I'm from Hot Springs, Arkansas. I grew up there, graduated there. My family's from the area, and I just moved home to practice dentistry with the community that I care about. And so I treat pediatrics. I'm also, Hot Springs is also a retirement community, so I get
Oh.
to see all ages as well. As far as my background, I went to University of Central Arkansas there in Conway, which is close by. And then I went to Texas A&M College of Dentistry, which used to be Baylor.
Okay.
And so I was in Texas for a little while. And my wife's actually from Texas.
Oh.
As am
Uh-huh.
I. You know, that's a big deal for me.
We have another Texan here.
Woo!
Yes.
Native Texan over here. So let's talk about the importance of establishing good dental care early with kids. How
Yeah.
do you do that?
Well, start young.
How young?
I'd say at a year old.
A year?
Or
That's when I took mine in, a year old.
I was
Because
late.
mine had so many teeth early. They had like almost a
you know, at about 1 year, you're getting teeth in the mouth. I would say the other caveat there is, or when we get teeth in the mouth.
Okay.
Okay.
But it's just so important that we get kids in and expose them to the dental office before there's a problem. We've got to
Right.
desensitize them. You know, noise is another big concern
The
for kids.
drill,
Just blasting a little air in their mouth to clean off a tooth to look at it, you know,
Yeah.
can make them jump.
It's scary.
And,
Yeah.
So getting them in and just desensitizing them to the noises and the sounds and the staff, you know, making them feel comfortable from a very early age, so that when something does come up, we can take care of it and it's not a shock to them.
Yeah.
And their first experience is a positive one. Now, on another topic, I'll say parent education is also
Vital.
extremely important.
So what are some of the things parents can do? What is the parents'
Great
role?
question.
Well, you know, I would at 1 year of age, probably the best thing you can do is limit sugar intake. And I always tell people that in dentistry, decay is more likely to occur based on the frequency that someone is taking in sugar. Now, a lot of people don't realize that sugar is not just in the apple juice. It's not just in
Candy.
Yeah, it's not just in candy. It's also in, you know, like chips. You know, it's carbohydrates.
everywhere.
Oh,
Yeah.
carbohydrate.
Carbohydrates, and as soon as it gets into the mouth, you know, bacteria, which is passed down usually from the mother, can then take that carbohydrate and make acid, and that's what causes tooth decay and eats through the outside hard enamel surface of the tooth. So, getting parents in and educating them on the fact that frequency of what we're eating and drinking is actually more important than the volume. You know,
Interesting.
so sitting down and eating some snacks, some candy, or maybe drinking some apple juice, that's not a big deal. What is a big deal is if we're doing it throughout the day.
Right.
And so
I've heard gummy vitamins too are like the worst thing you can do. Is that true?
well, gummies in general, anything that's got sucrose or fructose in it is that's going to cause more decay than regular sugar. It's a type of sugar that we didn't used to have a large intake of that we do now. And so that gummies are, we've got to watch out with
Don't
those.
do gummy vitamins.
Well, we don't.
Yeah, we don't either.
the gummy vitamin, if you do it and you're done, it's not a big deal. If it's
Okay.
once a day, I'm not going to say that's a big deal.
Okay.
But gummies in general are something to be concerned about.
No gummy bears, kids.
So let's say we are being the good parents who you want us to be, and we're getting them in early. How do you get your child to establish a good teeth brushing routine?
I would say just have a strategy.
Okay.
Have a time in the morning. For us, it's when we first get up, brush their teeth before we go to bed. Just, try to build a routine that becomes a habit. I think that's so huge.
Okay.
Making it a part of their day, that's going to be the game changer for kids.
Just like taking your bath, getting ready for
Exactly.
bed, and part of the getting ready for bed
Exactly.
routine is brushing your teeth.
Right.
Do you suggest any tips and tricks to, if this is your first time, your first kid, and you're like, every time I go in with a toothbrush, they're like, I don't want it, I don't like the way it tastes, whatever. What are some tips and strategies?
Each child is different, but I would say one thing that I've found to be very effective, and it makes it fun, Sonicare for Kids toothbrush.
Really?
Yeah.
Is that your favorite?
That's my personal favorite.
Wait, do you mean the ones that with battery powered?
Yeah.
For kids?
Yeah, they're
Yeah, we had
rechargeable.
electric.
Electric
yeah.
toothbrush.
Electric.
So Sonicare makes some. I think they've got. I don't want to misspeak here, but I think they've got some with Disney characters on
Oh,
it.
that's
probably,
fine.
that sounds.
If
But
I know-
isn't it any electric toothbrush for kids because it's hard for them to physically, right?
I bet he would like that.
Yeah, a nice thing about an electric toothbrush is you really just have to get it there.
Yes.
Oh, okay.
You don't have to do the manual
Just let it sit
brushing
there.
motion.
Right.
You just have to get it there and get it to the right spot, and it's doing the brushing for you. Not all electric toothbrushes are equal in my opinion.
Okay.
All electric toothbrushes are not created equal. You heard it
So
right
what
here
about
first
those
with
ones
Dr.
that you
Erwin.
hold like this and go, you know what I'm talking about, the tray ones for kids?
Yes, those I think have a place. For
Okay.
kids, probably not.
We have those too.
I actually have not used one personally,
Okay,
so
okay.
that's something that I'm actually interested in. I think that they could become more popular. Right now, I don't think they're a replacement for a traditional electric toothbrush.
Okay, good to know. That's a hot tip coming off the press here.
So let's say we've listened to you, Dr. Erwin. We have established a good oral hygiene routine for ourselves, for our kids. How do you start to identify potential problem areas in your child's teeth?
Look, you'd be surprised.
Really?
You can see it.
Yeah.
Wow.
You can see it.
Yeah,
I
I'm
mean,
like,
can
no,
we?
I can't.
Can we? Our untrained
You would-
eye.
Right.
You would be surprised the number of people that don't know what's going on in their own mouth. And one of the things that I use in my office that's extremely effective is a simple intraoral camera. It's just a little bitty camera on basically a stick. You can take a picture inside the mouth and show people pictures. And that's so powerful. They say a picture's worth 1,000 words. It's especially true in your mouth.
Wow.
But as a parent, looking in your child's mouth is going to be extremely powerful because you can see things and you can tell what's not right. If you see discoloration and it doesn't brush off, that's something to be concerned about.
Okay.
So look, and don't just look at the front teeth, look in the back. And then, an area that often gets missed in kids is upper molars,
Yeah. They're hard to
when
get to.
you get down on their level and look back up in there, have them open up, and part of when I'm brushing their teeth at night, I'm kind of doing an oral exam myself. Of course, I'm a dentist, but
You don't know how to turn it off.
I don't know how to turn it off.
Exactly.
But I'm doing that. I'm doing that. Morning and night, keeping up with what's going on.
Right.
to make sure the status of their teeth is healthy, you know. But color changes, you know, if your child reports pain,
Oh, right.
that's cause
sure.
for being concerned. That's actually one of it's not necessarily the leading cause, but that's one of the big contributors to school absenteeism is the tooth decay.
Really?
And having pain associated with
Oh,
teeth.
I didn't
Yeah.
know that. Is it a huge problem if you're young? Like my 3-year-old has already had 2 cavities, and I'm so good about brushing teeth. I've heard there's also genetic factors to cavities. Talk about kids' cavities.
That's not something to be concerned about.
Okay.
I'll tell you what is cause to be concerned.
Okay.
A good predictor of what's going to happen to the adult teeth is what's happened to the baby teeth.
Oh no.
And so that's the nice thing about kids if you catch it early is,
Okay.
you know, we can intervene, especially as dentists, and like I say, education's huge. But making sure that we're changing habits so that we prevent decay from happening on the adult teeth when they come in.
Okay.
So it's not a cause for concern, but it's something to take serious.
Okay.
Dr. Erwin, you talked about having that initial visit for your child being at 1 year old or when you start seeing teeth in their mouth. But what about regular checkup visits for a child? How often should those be scheduled?
You know, for a regular checkup, if you're not noticing any changes, every 6 months.
Okay.
Okay.
Every 6 months. That's going to give the dentist a chance to see what changes are happening in the mouth and to be able to see, you know, as the teeth come in, you know, orthodontics. That's something that's changed, you know, in the last few decades. But we're going to be able to see the adult teeth as they come in and be able to intervene if there's something that we need to do at an earlier age, you know, say 7 or 8 or 9, you know, if our front teeth are coming in either in front of or behind the tooth they're supposed to.
Right.
You know, sometimes you can do a little bit of orthodontics, you know, abbreviated orthodontics as phase 1 is another term that's used in dentistry. But we're just trying to see if everything is going the direction it needs to go. And sometimes we can do little interventions on the front end that can have a big impact on the back end.
Definitely.
So as far as a regular checkup, 6 months is terrific.
And how should we prepare our kids? Like we were saying, there's TVs now, so it's great. But is there anything we can do to prepare them for X-rays, exams?
You know, make it fun. You know, I've just been shocked myself the number of parents that talk about their negative dental experiences in front of their kids.
Oh, God.
And it just kills me.
Parenting 101.
It
Why
kills
would you
me.
do that?
Well, I see that, but you would be surprised the number of times parents talk about their bad experiences with the dentist in front of their kids. So channel
You're like,
channel that experience and make it different for your kids because it can be. So that would be my advice.
That's
so
cool.
so how to prepare them? Don't put any ideas in their head that are bad. Make it all positive. Make
so
it happy.
fun.
It's a happy visit.
Ooh,
You get a toy.
You get to go to the dentist today. Oh, that's going to be fun.
They always get to pick a little prize at our dentist. I don't
Yes,
know.
we have a treasure chest.
Treasure chest,
So
yeah.
positive reinforcement.
Yeah.
You know.
Yeah.
Positive, and like I
Yeah.
say, keep that first visit fun.
Yeah.
No matter what, keep the first one fun.
Okay. When we take them in for their regular checkups, what can someone expect? What can a parent expect at a pediatric dental checkup?
Well, an oral exam, and we call it it's a prophylaxis is the dental term, but a cleaning is the common term. So a cleaning and an exam. That's what you would expect at a checkup, and X-rays as needed. You know.
What does that cleaning involve?
Well, it involves getting the bacteria or plaque or tartar. You know, if plaque sits on the tooth too long, it becomes a mineralized substance that we call calculus, and it can happen on kids too. And I see that. I mean, periodontal disease is not as much of an issue with young kids, but the things that cause it can get there at an early age. So getting them in and getting all that stuff cleaned off, and there's instruments that we use that you don't have at home, and we can get, you know, once it's in the mineralized form, a toothbrush is not going to get it off.
Right.
So
Those are like the scrapers and the.
scalar would be another term for
right.
it. The technical term.
Yeah.
That's why he's the expert.
Didn't go to dental school.
He's the expert. He's the expert. No,
But
thank you,
scraper
Dr.
is a good
Erwin.
term too.
Yeah, a scraper.
That's what it feels like to us on the
does.
receiving
I actually
end.
love that when they
Get
I
out.
do. I feel like it's so clean after. You know?
No, I like the feeling of having clean teeth. It almost feels like,
Yeah.
Yep.
you know, but I don't like the process.
actual process.
But
I
I'm not going
like
to tell
it.
my child that.
No.
I'll be like, oh, I love the process. Oh, this is so wonderful. Oh, you get to see Dr. Erwin.
You're gonna love it.
We're
Yeah.
bringing him to
Absolutely.
you, Dr. Erwin.
Yeah,
We're going
there
to
you go.
fly in to see you.
Yeah.
Exactly.
We're accepting new patients.
Oh, I love it. I love it. I love it. Do you
Awesome.
do special accommodations for kids in your office? Because I know you said at your practice in Central Arkansas, you see young kids all the way up to grown-ups.
My special accommodation, it depends. You know, if they have a special need, you know, we try to accommodate that. You know, for some children, noises can be overwhelming.
Sure.
So keeping that in mind,
That's considerate.
you know, I do refer out to an actual pediatric dentist that has gone to further training. I do refer out if they have extensive dentistry that needs to be done that may need to be done under sedation.
Right.
So that's something that I do, but I just try to accommodate them based on their needs, you know, and that's different for everybody.
Definitely.
How does someone pick a pediatric dentist?
I would talk to friends.
Okay.
That's good.
Referrals.
I would talk to people. That's gonna be, word of mouth is powerful. Those that have had a good experience. But just because they've had a good experience doesn't mean they're going to a good dentist. So,
Right.
so read reviews online. I don't have a secret recipe there. Convenience is important. You know, the best dentist is the one you go to. If convenience is a big factor for you, then that's something to take into consideration.
Okay.
What are some of the common pediatric dental issues and the prevention that you use?
Well, decay is the biggest one.
So cavities.
Okay.
Misalignment of teeth, needing preventative orthodontics is another one. Missing teeth, missing adult teeth. That
Oh, yeah.
you know, that's when we take the big panoramic X-ray. That's really what we're trying to see is, are there going to be problems down the road?
And you can tell that early on?
I mean, you can see. I mean, before the teeth come in on an X-ray, you can see which teeth are coming in.
Wow.
Usually. Now, there's different times, like third molars, you can't see them at 4 or 5, 6 years old necessarily, but you can see the adult teeth coming into the mouth, in the jawbone forming on that X-ray. So, trying to get an idea of what the future looks like is important.
sure.
So we know if we need to make special plans, and prepare parents and our kiddos for what that looks like.
What about I've heard of baby bottle decay when kids are on their bottle all night, when babies are on their bottle. What is that?
So baby bottle decay is oftentimes is whenever parents let the child go to bed with
With the bottle in
with
the
the bottle.
mouth. Full access all night long.
And if it's not straight water, it's a problem. And so going back to the frequency is much more of an issue than the volume. So it's not a big deal to drink the milk during the day, but that your saliva is constantly trying to remineralize and rehydrate and rejuvenate the tooth. And whenever you're putting in a carbohydrate, it's the milk.
Lactose. Yeah.
Yeah, when you're putting in a carbohydrate that is it enables decay. So frequency, that's the problem. And so if kids are going to bed with a bottle, and I'm not a pediatrician giving pediatric advice about milk, especially on anybody under 1, but avoid letting your child go to bed with a bottle.
Right, that makes sense. What about breastfeeding right before bed for a baby? But you don't, like, I brush my baby's teeth, but then I breastfeed him.
Probably not an issue because
Okay.
If you're breastfeeding, likely we don't have teeth in the mouth at that point. So can be, especially if the mother's pumping and they're bottle feeding, but it is something to be concerned about.
Oh, okay.
It is something to be concerned about, but a lot of times at that point in time, it's the incisors, the front teeth. They're less prone to get decay.
Oh, okay, good to know.
So you know, it's something to be concerned about, but not. I wouldn't let it keep you up at night.
Oh, good. Okay. So,
Well, let's shift gears and talk about injuries, because I'm sure you probably
we've
see
had
that.
one of those.
Oh, you've had one of those? Was it from sports?
Nope. My 3-year-old was running with a toy in his mouth, fell, and the tooth is slightly gray. You can't really tell.
Oh, goodness.
Yeah, it's fairly common.
Yeah.
I mean, and
Oh.
it can be at a variety of ages, but it's most concerning when you have an adult tooth.
Oh.
And those adult teeth can be in the mouth, you know, fairly early for some kids. And so I do see those. You just have to treat them as they come, you know, and each scenario is different, you know.
What can be done? Are there any things that can be done preventatively to, if you know, I mean, your kid's prone to fall or they're in sporting
Or
sports at all?
Yeah.
You know, one strategy if we're doing sports that are contact sports or something of that nature, a mouth guard, football especially, a mouth
Okay.
guard. But, you know, kids that are in sports and let's say teeth are moving around a lot and you just need to get something in there to protect the teeth.
Because dental care can be expensive. And
It is.
sometimes for people, it's like, I would rather just spend that money somewhere else that I have to spend it and I'll just wait a little while. What do you say to those people out there?
For people that are, dentistry gets more expensive as you wait, usually. You know, you need to be willing to spend money, and even if you don't have it, you know, consider financing options. You know, one of those strategies is the CareCredit credit card. I keep that in mind, but just in expressing the importance, and patient education's huge. You know,
Yeah.
expressing the importance of them, importance of dentistry to them, and you know, looking at it as an investment. You know, because I always tell people the best thing to invest in is you.
Okay, Dr. Erwin, this is the part of the show called Ask the Expert. This is when
Let's do it.
members
I
of our
love it.
audience get to ask you a question
Okay.
through us. Here's the first one. Dr. Erwin, how often should I replace my kid's toothbrush? Are the kids' electric toothbrushes better than the standard ones? This is like 3 questions in one. Is there an age when kids can start to use electric toothbrushes?
They
This
are
is all
great
about the electric.
questions,
So
though.
when do you replace it? Is it okay to use electric? Like, are those better than the regular ones? And at what age should we start?
So as far as replacing toothbrushes, monthly is probably best. If
Okay.
you can't do it
Monthly.
monthly, every 3 months for
Okay.
sure.
Oh, okay.
Or if you get sick and you recover,
I always
Toss
replace
it.
toothbrush
do
after I
too.
get sick.
I do
Always.
too. I feel gross after.
Toss it.
Yeah.
Toss
Okay,
it.
Gone.
perfect.
Okay,
Good.
thank you.
We've been doing that.
Validated.
so that's good. As far as what was the next question?
Electric versus regular
right.
traditional toothbrush.
I love electric toothbrush. I like the Sonicare for kids.
Okay.
There are other good electric toothbrushes. So don't just take
Don't
that
quote you on it.
recommendation. But you know, that's my personal favorite. You know,
Okay.
but
Good to
the
know.
best toothbrush again is the one you use.
That's
There you
right.
go.
There you go.
Okay.
So don't let that be a threshold to entry issue.
Okay.
Okay.
Get whatever you can afford and use it.
Okay. And when can a child start using an electric toothbrush?
Any age.
Okay.
As soon as they can tolerate it. You know, I have had some children that, you know, it goes back to the noises and sounds. You know,
yeah.
making sure, you know, but it can be fun.
Yeah, it could be.
That's fun. When I introduced an electric toothbrush to my children, that was a fun event, and they love it.
They love it.
They're even letting them pick it out too.
Yeah,
like
the color.
bring them. Yeah.
And,
so
and I
true.
think giving kids control, you know, like you said, let them pick the color. You know, giving them some control over their dental stuff. That's so important.
That's great.
Oh, you know what? This is not an Ask the Expert question, but I have to ask this as a follow-up. If we're talking about toothbrushes, toothpaste, there are so many different types
Great
of toothpaste
question.
for little kids, and I get confused. I know there's the ones that don't have fluoride, and that like the training toothpaste, and then there's the ones that do have fluoride, and we have moved over to the ones that do have
and
fluoride
I hear
now.
different
Is that
things like fluoride's bad, fluoride's good.
Same.
What do we
Can you
do?
tell us what to do, Dr. Erwin.
I personally,
Glad you asked.
I think that using a fluoridated toothpaste is the number one best thing you can do.
Okay. Woof.
And
Okay.
I think living in an area that's got fluoridated water is also extremely helpful.
Oh.
That's one thing. As far as which toothpaste to use, I do look for ones that have fluoride in them.
Okay.
There are tons of toothpaste out there. There's a lot of great products on the market. there's not one specific one that I endorse.
Okay.
I personally use Crest for Kids for my own children. So.
Is there one to steer, or is there an ingredient rather? If you're not going to endorse a certain brand, but is there an ingredient we should make sure is not in it?
Right.
Not really. One thing to be aware of is, and I see this infrequently, but I do see it, is you can have allergies.
Okay.
And so sometimes we have to trace down, is the allergic reaction caused by the toothpaste we're using? And
Okay.
some people get ulcers, and there's some correlation to certain chemicals that are used in toothpaste that they have kind of traced to maybe make the prevalence higher. So it's only an issue if there's something going on in the mouth that's concerning.
Okay.
Such as an allergic reaction.
Okay, that's good to know. But fluoride, good.
I'm so glad you asked that.
Well, you know what? Because they have all those training toothpaste, and
Yes.
sometimes I base it, and I know I'm not alone in this as a mom, on the flavor that I think he'll like.
Well, then they will
know?
tell me. I don't.
Oh, he'll tell me.
I mean, you've got to pick something that your kids will like.
Okay.
But
Yeah.
you can use fluoride from an early age. And, when they're young, they say use a smear or a pea-sized amount.
Oh, I'm glad you're
Little
telling us how
tiny
much to
bit.
use.
I know we forgot. That's
Yeah.
a big,
Yeah.
good one.
Or not a pea-sized amount, a rice-sized amount.
Rice size.
Okay, rice size.
A pea-sized amount is when we get a little bit older. But a smear or a rice-sized amount of fluoridated toothpaste is important, even on young kids.
Okay.
Okay, great. Thank you.
Yeah.
Now, this next person asks, my child sucks their thumb. At what age should I be concerned about this habit affecting their dental development?
We need to be done with it by 2.
By
There you
2.
go.
That is the official
And
answer.
I would start trying to move away from it far before you get to the 2
Yeah.
year mark.
Yeah.
So start, as we wrap up breastfeeding, I would try to wrap up habits. I would try to wrap things up before we get to 2 years of age.
That makes sense.
Okay, Dr. Erwin, this person says, are natural toothpaste, flosses, and mouthwashes just as effective for children's teeth?
So, and that probably means fluoride free, because that's I don't know
Yeah,
about
exactly.
You, but yeah.
Yeah, like if you go to like a health food store or something, you
Exactly.
get one of those.
I wouldn't say they're as effective, no.
Okay.
Okay. Well,
I would steer
not?
away. Well, because they don't have the fluoride in it. Fluoride makes it where the tooth is, it takes more as acid to dissolve the tooth. It actually integrates with the chemical structure of the tooth.
Okay.
So, if you're not using it or getting it from somewhere, you're going to have a higher incidence of decay, even if you have better habits. So I would say let's stick with fluoride.
Okay.
Okay,
Good to
thank you.
know. Thank you. This next question is it safe for young children to use Waterpiks instead of traditional floss?
For children, Waterpiks, the only issue you run into there is dexterity and them getting it to the right place. It's if the parent is overseeing it, but that's the same with brushing teeth. I'm responsible for it. Sometimes I'll let my kids play.
Right.
But when they're young, before they're of the age where they can responsibly take care of their teeth, I'm responsible for it.
Mm-hmm.
If the parent's using it, that could be effective. I don't think that a Waterpik is a replacement for floss.
For floss, yeah.
A Waterpik has a huge advantage when we're talking about periodontal disease. Even there, I still don't consider. I don't think we should get rid of traditional dental floss. The best floss is the floss you use.
Right.
Yeah.
So if we're getting there and we're getting between the teeth, I always tell people to not just pop through the contact, but hug each tooth like you're scrubbing it as you're.
that's good to know.
That's
too.
good to know, yeah.
Well, Dr. Erwin, this has been so educational and
So-
such a gift
yeah.
for us as moms.
Thank you.
Who want to make sure. No, thank you
Yeah.
for
Yeah.
coming and educating us and being the expert. We need to have you back.
Yeah, definitely.
Yeah,
Thank
no,
you.
I'll be glad to.
Oh,
I've
awesome.
enjoyed the opportunity.
Oh, thank you,
Thank
Dr.
you.
Erwin. Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
Hey, stick around if you want to hear more about health and wellness in these episodes of Care Experts. Don't forget to like and subscribe.